Well, May is Mental Health Awareness Month, and it's important for us at WLOX to make sure we're breaking down the stigma of mental health and really explaining what mental health awareness is about. And that is where Dr. Geraldine Datz, you're the owner of Southern Behavioral Medicine Associates here in Hattiesburg. Tell us what you do here.
We offer full-service psychological treatment from diagnosis, testing, counseling, and a lot of specialty services like pre-surgical assessments and ADD and neuropsychological assessments.
I feel like ADD, you're already like speaking my language here.
Aren't we all?
I think just a little bit. So is this a service that you provide based on referral? Can folks just book an appointment and come in for a consultation?
People can come in self-referred. They're often referred by physicians. Sometimes their insurance company will connect them with us. We're one of the few practices in the area that's almost 100% insurance-based.
And every single approach is a little different because everybody has different needs, and you take that into consideration.
Absolutely. We pride ourselves in whole person assessment and proper diagnosis. You know, just like you would want the correct medication for your diabetes, we want the correct diagnosis for your mental health issue.
Absolutely. So should we go take a look at the office?
Absolutely.
Awesome. So we're talking about mental health as a whole, but you were mentioning before we were on camera that mental health is health. Dive into that a little bit because that's an interesting concept.
Yeah, absolutely. We really prioritize our physical health. You know, we prioritize fitness and what we eat, and what we think and how we feel is equally important. And we actually know that mental health can influence our bodies. It can make us more suggestible to illness, disease, and when untreated, things like depression, anxiety, substance abuse can have some really dire consequences.
Yeah, it's an interesting concept that I hadn't thought of until you said it, that there's so much physical health. There's so much money annually spent on what we do to maintain our physical health that we forget about the mental health side, when really if we focus on the mental health side, it might help everything else as we're going along.
Absolutely. You know, mental health drives motivation, sleep, energy level, relationships, and I really encourage people to prioritize their mental health. And actually, nationally, there's a huge push for that. Ever since COVID, when we all became very much aware of mental health and loneliness and changes in life, there's really been a push to accept our mental health, to seek treatment for it, and to provide safe spaces for people to talk about it.
Glad you brought that up, because mental health, there's a stigma. I can't believe we're here in 2025 still talking about the stigma around mental health, but it's a real thing, and it causes people to ignore the signs. It's
a very real thing. You know, it can depend on people's cultures, their beliefs, their own personal feelings. You know, think about it. It can be hard to trust somebody with your deepest secrets. And, you know, when people come here, I tell them, you know, we're not a family member, we're not a friend, we're trained professionals that are on your side, that you're essentially hiring to look out for your own best interest. And where can you find something else like that?
Sure. You know, you hear this phrase a lot. It's okay to not be okay.
Yes.
And I feel like that helps me to understand that it's part of life. Like, you're not always going to be perfect. You're not always going to be in the best mood, and it's okay to not be okay. But then when that becomes, you know, more than just a bad day, becomes a bad day, becomes a bad week becomes a bad month, and you can't seem to get out of it, that's when maybe it's time to start asking maybe the professionals for some help, like you mentioned.
Absolutely. You know, a lot of times that's when people come for treatment, when they're most distressed. We actually encourage people to come early on. And a lot of people actually come for therapy just for support in life, or to be better at something they're already doing, or to become a better parent. Or I had a client last week that was talking about her family history of mental illness. And she wasn't sure if she had an issue, but she knew people in her family did, and she was trying to be proactive. And I would love to see so much more of that. Think of how different the world would be if we were more proactive about mental health, not just reactive.
Sure, and that seems like that's where the world is now, right? Reactive. It's like, I'm not going to do anything until I have to.
Sure.
When really, if you got ahead of it, then you wouldn't have to do something. You just want to do something. You hit a nail for me. I'm a relatively new parent, so it didn't occur to me that I could seek professional help just to be a better parent, or just to be a better person in general.
Absolutely. You know, self-esteem, you know, patterns that we have, you know, often it isn't until early adulthood, when we're working or married or in a relationship or in a series of failed relationships, for example, that we start to question, well, what am I bringing to the equation? And therapy is really about working with someone who's professional and skilled and trained, not just listening to your issues, but actually helping mold and transform you into a better place.
So let's talk, when someone walks through the door, let's talk about that assessment piece of it.
Absolutely. So that's a really big piece of the practice that as the owner, I felt like was missing from healthcare, where people come in for treatment and they kind of get a one-size-fits-all. And everyone who comes into our practice gets a kind of mini psychological assessment, and it will give them a very good sense of their strengths and weaknesses. And we do that just even if someone's coming for therapy. And we also share those results with the client. And I don't know of any place that is actually doing that. We talk about diagnoses and we talk about steps to implement a treatment plan. Now, some people come in for very specialized testing, things like attention deficit disorder, or an issue at work, or substance abuse, addiction. We do neuropsychological assessments if people have had memory problems or accidents or injuries. So those are more specialized types of assessment, but all of them bring us to the same result, which is what diagnosis are we actually treating?
So we've got about a minute left. Let's talk about how the service is delivered in terms of the practice.
So for one, I mentioned earlier, we accept most insurances, which is a real advantage because that allows us to deliver care to more people and make it more accessible. Everyone comes in, meets with a licensed professional, so we all have licenses and are registered with boards, so it's not a fly-by-night type of environment. Everyone's very skilled, and we actually try to match the patient with the provider before they even come in the door. So we do a pre-screen, we find out what the critical issues with the client is, and then we try to match them with a therapist that has that area of expertise.
And that all happens in the initial meeting?
Yes, or prior to that, yes, when we're assessing them, checking their insurance benefits, making sure that they are aware of any coverage issues. The person that they are meeting with has actually been pre-chosen for that person.
Anything these folks can do to prepare for that meeting before they come in?
Just have an open mind, I would say, and to be relaxed, and also to remember that it's their choice. If they don't match with someone, that's important. So speak up about it, and then we can talk about it. They can meet with me, they can meet with another provider, but don't give up.
That's the key. You heard her right there. Dr. Geraldine Datz and her team here, fantastic. Don't give up. It's okay to not be okay. And listen, if you feel that you'd just like to have a conversation about something that doesn't feel right, or if you want to get ahead of it, you want to just get out on the best foot every single day, give them a call. You see the phone number, you see the website there at the bottom of your screen. Let them know they're here to help you and get you out on the right foot.
Thank you so much.
Thank you so much.
It's a pleasure.